Take a look at this case. This is a patient who had significant fat bags underneath both eyelids, lower eyelids. You can see in the corner of each eye there's a distinct pocket that bulges out, and along the inner corner down below there's a linear oblique fat pockets that are also visible. This is a technique of transconjunctival, meaning from the inside of the eyelid, where we sneak underneath and remove these specific islands of fat that are connected, but you can think of them as islands. And once they are removed, you can see them placed outside to replicate the positions from where they were removed. Sometimes these can be repositioned without having to remove them. And some surgeons do both. I do both depending on the situation. But in order to get an optimal lower lid outcome, there's additional things that will have to be done. Laser resurfacing is a good thing to do for the skin on the outside. That improves the pigment and causes some skin tightening. In addition, replacing the volume loss inevitably that exists in these situations, as you can see in the pre-operative photo, those areas should be volumized further with a little bit of fat grafting. So the three criteria that are important to assess and treatments hence recommended should be removal or repositioning of the fat that bulges out of the lower lid, laser resurfacing of the skin to improve the pigment and create some skin tightening, occasionally maybe even a little skin removal by a pinch technique where you remove and cut out some skin. And the third one is to add a tiny bit of fat to the hollowed out areas of the lower lid and the cheek that completes the look for a very well done lower lid blepharoplasty.